Okay, in this station we will discuss the bones that form the foot. As you can see here, this is the foot as a whole, and the foot is divided into 3 regions. This area it is called the forefoot, and the mid area here it is called the midfoot, and the back of the foot is called the hind foot. We will discuss the individual components of the foot and to describe the joints that forms in between them. The first one here, actually to give you some orientation, this is the left foot, okay, because this is the big toe on the medial side, and this is the little toe on the lateral side. So this is the left foot. The upper bone here, this one, it's called the talus, and this talus will articulate with the articular surface or the distal surface of the tibia to form the tibio-talar joint, which is the other name for the ankle joint. Okay, then the ankle joint, as you can see it here clearly, this is the talus articulated with the distal part of the tibia. Okay, it is not articulating with the fibula, it's only with the tibia. So this talus had its upper end. This upper end is called the trochlea, which articulate with the tibia. And anteriorly we have the head of the talus, and this head of the talus will articulate with the next bone, that is the navicular bone, at the talonavicular joint. Okay, it is called the talonavicular joint. Behind the neck here, behind the head we have the neck of the talus, and on the undersurface of the talus we have the articular surfaces for the calcaneus. Okay, and this undersurface of the talus will form what is known as the subtalar joint with the calcaneus. Okay, this is the second bone here. It is the calcaneus bone, and when you see it from below here, it has 2 prominences. This is called the medial or the lateral and medial calcaneal processes. Okay, on the back we have this rough area. It is called the tuberosity of the calcaneus, and here it is the insertion of the Achilles tendon, which is a common tendon for the gastrocnemius, soleus, and plantaris muscle, which are the muscle of the posterior compartment of the thigh. On the lateral aspect, we have this projection. It is called the peroneal trochlea, and this trochlea will divide the tendons of the lateral compartment of the leg, which are the tendon of the peroneus longus and peroneus brevis. The peroneus brevis will pass above the trochlea, and the brevis below this trochlea. Okay, on the medial aspect we have this characteristic projection. It is labeled in blue here. Okay, it is labeled with ink here. This is called the sestentaculum tali. Sestentaculum tali, it is the medial projection, and it bears the medial or the medial articular surface for the talus. Okay, behind it we have the posterior articular surface, and in front the anterior articular surface. The sestentaculum tali below here, it's grooved by the tendon of the flexor hallucis longus, which will pass from the posterior aspect of the leg directly into the big toe. Okay, this is the undersurface. This is the sestentaculum tali. It is a very characteristic and commonly asked in exams. Okay, then these 2 bone will articulate anteriorly with other components of the tarsus. Okay, this is called the tarsus. As I have already said, the talus will articulate anteriorly with the navicular at the talonavicular joint, and the cuboid laterally will articulate with the calcaneus laterally will articulate with the cuboid. Sorry. Okay, the calcaneus will articulate anteriorly with this bone. This is called the cuboid. Okay, In front of the navicular, we have these 3 bonds. It is called the 3 cuneiform. It is called the 3 cuneiform. This is called the medial, intermediate, and lateral cuneiform. And the 3 articulate with the navicular posteriorly to form the cunei-navicular joint. Okay. Then this in general the bones that form the tarsus. Okay. This tarsus will articulate with the bones of the midfoot or with the metatarsal at the tarso-metatarsal joint. This is the tarso-metatarsal joint, and this is the metatarsal joint. Okay, this is the tarso-metatarsal. These are the 5 metatarsals of the foot. This is the first one. This is the second, third, fourth, and fifth. Okay. What is characterized the fifth metatarsal is having this tubercle, or this is called the tuberosity of the fifth metatarsal. Okay, and this protruded area, it is provided for the insertion of the peroneus brevis muscle. Okay, peroneus brevis muscle will be inserted in this fifth metatarsal tuberosity. On the upper surface here, we have the insertion of the peroneus tertius, which is one of the muscles of the extensor compartment of the leg. You will see it later, inshallah. Okay. Below here, on the undersurface, you can see this groove on the cuboid bone. It is formed by the tendon of the peroneus longus muscle, and this groove here, okay, this area here for attachment of the tibialis posterior muscle. It is mainly attached to the navicular bone and to all other cuneiform. Okay, it gives insertion here, but mainly to the navicular bone. This is the peroneus or the tibialis posterior. Okay, regarding this is the first metatarsal. Okay, on the head of the first metatarsal, on the medial aspect, we have the insertion of the tibialis anterior muscle, and on the lateral aspect, on the medial aspect of the head of the first metatarsal, we have this is a sesamoid bone, and on the lateral side, this is another sesamoid bone. Okay, and both of them will provide a passage in between for the tendon of the flexor hallucis longus, which will be inserted in the distal phalanx of the big toe. Okay, on each side we have origin for the medial and lateral head of the flexor hallucis brevis. Okay, on the base of the first metatarsal here and the medial cuneiform, on the medial side we have the insertion for the tibialis anterior. On the lateral side we have the insertion for the peroneus longus muscle. Okay, these on the base, not for on the head. Okay, let us continue to demonstrate the other bones that forms the foot. The head of the metatarsals, and the head of the metatarsals will articulate distally with these bones, and these bones are the phalanges. Okay, then these are metatarsophalangeal joints. Okay, these are the metatarsophalangeal joints. We have a number of 3 phalanges: the proximal, medial, and distal. For the lateral 3 toes, and with the first or the big toe have only proximal and distal phalanx as in the hand. Okay, on the undersurface here, you can also appreciate the phalanges has their bases proximally and distally. They have the head. Okay, and in between this space we will find the muscles of the deep foot. Here the interossei muscle. Okay, the interossei is a dorsal and plantar interossei muscle, and we will see it in details inshallah. So these in general the features of the bones that form the foot, and in summary this is the talus articulate with the distal tibia to form the ankle joint, and this is the calcaneus which articulate with the talus, and in front articulating with the cuboid at the calcaneo-cuboid joint. Medially we have this is a navicular articulated with the talus at the talonavicular joint, and this is called the metatarsal joint. Okay, the navicular will articulate with the three cuneiform to form the navicular joint here, and in between the tarsus and this is the metatarsals, and this is the base of the metatarsals, we have the metatarso or the tarso-metatarsal joint, and the tarso-metatarsal joint will connect the basis of the metatarsal to the cuneiform and the cuboid bone. Distally we have the metatarsophalangeal joints, and in between the phalanx we have the interphalangeal joints.